I will turn it over to Allison.
Thank you. Good morning, Commissioners. This is the March 16th Board of Health meeting. Typically, at this time of the year, you'll hear us talking about county health rankings, but they won't be released until March 29th, so we will have a special event that I'll tell you about at the end of the meeting that will be upcoming. Today, we have several speakers from within the health department. Some you may know and some you may not. So that being the case, I'll do introductions for each of them as they come up. The first person we're going to have is Barb Byers. She's a registered dietitian at the health department, and she has a lot of expertise in breastfeeding and helping moms with that area. And she's going to talk to us about the business case for breastfeeding. So I'll turn it over to you.
So many young families today are choosing breastfeeding, human milk for their babies. There's a lot more awareness now that mother's milk is the normal food for babies, and that it has along with it many advantages. Advantages to the mother, advantages to the baby, and that translates into advantages for all of us, because if babies are healthier, then we save money all the way around. In addition to that, formula, which is the alternative, is actually rather expensive. It can cost up to $1,500 a year to buy formula for your baby. That's a lot of money for a lot of families when they already have a lot of other new expenses with this new baby. Now, moms today are busy. A lot of moms go back to work. You probably are well aware of that many women are working before they have a family and while their children are young. Even if they're not working, they have places to go, things to do, and they take their babies with them. And so there are two ways really that we can help mothers to be able to continue breastfeeding their infants. Back in 2006, the state of Kansas passed a law that said that a mother could breastfeed any place she has a right to be. And here's a little card that I'll pass out to you in a little bit that has that information on it. And we give these out to women in the public so they know that when they go to a restaurant or to the mall or to a swimming pool or to the library or wherever they are, that they can nurse their baby without someone telling them that that's inappropriate. And a lot of employers are choosing to support their breastfeeding moms as well, their employees. And as a result of that, back in 2010, there was actually an amendment to the Fair Labor Standards Act that employers were required to provide time and a place that's not a bathroom for moms who were working to be able to pump milk for their babies while they're at work. Now, employers don't have to pay for that time. Usually that's a break. You have a lunch break, you have a morning and an afternoon break, and usually moms can use that break time to pump milk. But it's nice if they have a private place to do that. Now, why would an employer want to do this? Why would it be an advantage to them? Remember that breastfed babies get sick less. So if you're the parent of a breastfed baby, you're going to miss less work. And a study that they did actually showed that one-day absences occurred more than twice as often for mothers of formula-fed babies versus breastfed babies. Ear infections, respiratory illnesses, all those kind of things that keep moms at home. So if babies are healthier, it lowers the cost of health care and health insurance. Less trips to the doctor, less medication to buy, less time admissions to the hospital. They've also done some studies that show that moms really appreciate it when their employers provide this time and place for them to pump. They're more loyal to their employer, And they work a little harder because they want to get their work done while they're at work so they can go home. And so, and it also gives good public relations out to the community. And we have quite a few employers here in Topeka that do provide a room for their employees to use. Show you some pictures in a little bit. If there are enough employees to warrant it, a special room might be set aside. I know that Security Benefit, for example, a large employer, Hills, large employer, they have rooms that are really in constant use because they have enough employees to really use it on a daily basis. Usually several different people at one time are using it. Other places might be smaller, and they don't really need a dedicated room because it wouldn't be used that much. But they at least have developed a policy that says if a woman is returning to work and breastfeeding, that the supervisor, the HR department will be supportive of that and will work something out so that there is a place that she can use. That not necessarily that's always there, but at least during the time that she needs it. A room could be very basic. Needs to be clean, needs to have a chair, probably an electrical outlet to plug or pump into, needs to provide some kind of privacy. It's nice if it can be a room with a locking door, but that's not always possible. Some places just have a curtain and a sign up so that the other employees know if the sign is here that they should stay away from that area and leave mom to herself. It's even better if the room has a sink with running water, or maybe even a small refrigerator to store milk in, a little table to put her pump on. Those are nice things. Some places have added a phone or a computer so mom kind of has something to do while she's there. It's nice if it's attractively decorated, but those things are not necessarily. Most moms are just happy with a nice room with some privacy. Now, this is a picture of our breastfeeding room at the J.P. Lewis building. This was the break room in that building prior to the health agency moving in. You can see on the left picture there's a little counter there with some cabinets and a sink. And on the left side there was space for a bigger refrigerator. We just have a little one in there. To the other side of the room you can see we have some chairs. This is definitely bigger than most employers would need, but we also use this room for visitors that come. And this is right off of the WIC waiting room, so we have a lot of young families and moms and babies that come in, and this is very convenient. So it's kind of a dual purpose room. It can be used for employees and for families that are coming in from the public. Here's a picture of a room at the Butler County Courthouse. You can see it's very basic with a chair and a little table, some disinfecting wipes, and then on the other side they have a small refrigerator. Looks to me like this room might also just be a shared room because they have this curtain. I don't know if it's a big window that they curtained off or if it's really somebody maybe has an office on the other side and that just separates the areas. This is a picture of the room at the Neosho County Courthouse. The thing I liked about this is that on their women's restroom, they put a little sign that identified where the breastfeeding room is. I think most moms, if they're looking for a private place and they don't know if anything's available, they look to the restroom, which isn't usually very clean, not a great resource, but this way a mom could tell, okay, there is a space that I can use. I just need to go to the other floor. So I was just brainstorming about places that might be under the county buildings that might use or benefit from a room. Of course, the courthouse is a room with a lot of employees and also a lot of visitors. So I could see that a room here could be used pretty frequently. I'm not sure, I don't work in this building, but it seems like it could be. I know there are female employees at the jail. I also know there's a lot of young families that are visitors to jail inmates. So I would think that a room there could possibly be used by both staff and visitors. I learned recently that in the lobby at the Sheriff's Department, they do a lot of custody exchanges for moms and dads who are sharing the custody of their children. And I know I see women that are in situations where they're breastfeeding and baby has to go with dad for a few hours, or as they get older, maybe baby goes with dad even overnight. So moms are pumping milk to send along with dad while baby's with dad. And I just think any breastfeeding mom and baby that have been separated for a few hours are probably glad to get together and nurse when they get back. So that might be a spot that a room could be used. The Expo Center. I see a lot of family events that occur there. And so I, again, would think that a room there could be really used a lot by visitors. The circus, rodeo, just all kinds of events where families come there, graduations. And probably one room is enough. And then some signage around just so moms know it's available. I know a few years ago when they remodeled Bill Snyder Family Stadium in Manhattan, they included a lactation room, and it gets a lot of use. I've talked to moms that have babies. You sort of know who to talk to about things like that. Women know who to look for. And they've told me that it really gets a lot of use. They started out with about 3 chairs, and already at the first football game they had to bring in 3 or 4 more chairs because so many women were there using it. So I think if it's there, they'll come. Yes.
Have you spoken to Brian Cole or the sheriff, the extension office? I mean, have you talked to these people and made an effort to
I have not reached
see?
out to them.
Okay.
This is really our first effort to reach out.
Okay.
So, yes, that's a very good question.
All right. Thank you.
And that fits really with what I was going to say next, which is the business case for breastfeeding, which was the title, is a resource for employers about how they can support their employees. And it's also a resource for mothers to know what they can ask for and what other places have done. And so I'm going to give you a copy of this little pamphlet that has information about the website. There is a person in Kansas that is trained and available to help businesses with setting up rooms like this. And so for more information, yeah. There's also a list of employers on their website that have rooms dedicated for breastfeeding moms, and so you can kind of see what other places have done and get a little publicity even that way. Hey, huh?
Commissioner?
It might be something to include in our space planning with
excellent.
FOG. Have you mentioned it? Okay, good.
Okay, good.
So that might be something to get to him, even more information, not just from the health agency, but from,
Yeah, excellent point.
good, okay.
Then there's another little piece of this, which is businesses open to the public that reach out and say to moms, hey, breastfeeding is welcome here. You can come in this restaurant. You can come in the library. You can come to this toy store. And if you need to nurse your baby while you're here, we're going to be okay with that. We're not going to shame you, tell you have to cover up, tell you have to leave. We know that it's your right to do that, and we're going to be supportive of that. We have done this at the health department. We have a few other businesses around town that have done this. It doesn't really take any expense or any space. It just is a little sign to mom that you can come here and be okay. So I'll also include in your packet some more information about that. And last but not least, I just thought I would point out that August the 1st, the first week of August, is World Breastfeeding Week. And a lot of times news agencies are looking for things that they can talk about their community and breastfeeding. So if there's anything that could be done before the first week of August, that might be a good way to get a little publicity. Although I think it's available anytime, but that's also, it gives you a little target to shoot for. So I have some information I'll leave with you. Any other questions
Any questions?
that I can answer for you? There's 4 copies there, so there's one spare.
Thank you very much.
Thank you for your
Great
time.
Thank you.
Information. Yeah.
Thank you very much.
Okay, the next thing we're going to talk about is environmental health, just as we continue to try to increase awareness of the programs and services we offer. I'm going to have Ed Kalis come up, and he's going to share a little bit about environmental health.
Good morning.
Wow. What I'm going to do this weekend.
Well, there'll be a test next weekend. How's that sound?
Very good.
Good morning, Commissioners. Ed Kalis with the Health Department. As of last month, I've been in environmental health for 25 years.
Wow.
And when I say that out loud, it really makes me sick to my stomach. But environmental health is one of those areas in public health that is a little confusing to people. And some folks don't really know what we do, don't know what to expect from the staff or whatever. It's just a mystery to a lot of people. One of the distinctions that we have in public health is that nobody knows who we are until something goes wrong. And that even applies more so to environmental health. What I've given you is called the Local Board of Health Environmental Health Primer from the National Association of Local Boards of Health. This is a document that I saw years and years ago. And I thought, well, wouldn't this be nice if the folks that actually kind of ran my life when it came to my environmental health career really knew what was going on. So it's in its second edition. There's a lot more stuff that was there than before. But this is a good document, whether you use it as a reference, study material over the weekend while you're doing whatever else. It's good for you all to have as the Board of Health. I don't understand why this isn't part of a board orientation, but I know you guys have to orient to a lot of things, so that's probably the reason. But there it is for you to use. I do want to let you know that we have all sorts of folks here in the county that work in environmental health, and they are all more than willing to give you information, answer your questions, do what you need them to do to make you more aware of what's going on and to help you understand it better. Really quickly, the book itself it's a pretty thick book, and it does kind of go through the breadth of what environmental health covers. A lot of people really think of environmental health, especially at the community level, just covering septic systems. And in some states, it would cover food inspections and things like that. But it's huge. The National Environmental Health Association defines environmental health in a very generic way. It's the science and art of keeping people safe from the environment in which they inhabit. And it's a pretty broad definition, and it includes a lot of different kinds of areas. And on the slide there, those are the things in this book. We do a lot of this stuff here at Shawnee County, and I'll show you a slide here in a second about what we actually do here at the local level. But the Board of Health, the state lawmakers, the state health department like KDHE, they all have some kind of input or activity in each of those areas for the most part. It's pretty big. And a lot of places don't do everything, but some of the larger counties do. I started in Tulsa County, and when I was trained to do a little bit of everything. And it was very interesting. But wherever you go is whatever you do, so the different localities have a say in how things are done. In our county, most of what we do in the environmental health team itself is local. All of this solid waste, the wastewater and water treatment, that's all done at the local level, and the Board of Health, the county commission, has control over that. So if they decide we don't need to have septic tanks in Shawnee County, they have the authority to do that. Now, after you read that book, you'll probably not make that decision, but it is an option. And you do have a lot of authority to affect public health through the environmental health programs. Now, for Shawnee County itself, we don't do everything. That whole list of what you saw in the table of content of the guide there is not something that we do. We have done things through the years that we don't do anymore. We used to have a lead poisoning prevention program. We used to be the food inspectors for our county, but both of those things either don't exist or they're done by other people. The state has pulled a lot of the environmental health programs back to the state level. We used to have an air quality program contract with KDHE, and that hasn't existed for about 10 years now. We would inspect Goodyear and all of the large facilities. It's being done, but we don't know to what degree, and we really don't have a lot of knowledge about how that's working. And that is one of the things we're trying to improve in the future. When we don't do it, how do we know that that process is being assured? Who's doing it? How is it being done? And is our public being protected? In the unincorporated county, as far as the cities that have incorporation, Topeka, Auburn, Rossville, Silver Lake, and Willard, what we do there are nuisance complaints. If they're bad enough and the state law applies, typically we will probably get involved in those. And then water and wastewater, the septic systems. Is someplace close enough to a sewer to hook up? And if they can, are we going to allow them to? And if they can't, how do we need to proceed from there? In Shawnee County, we are in control of all of the child care licensing inspections, and child care licensing is considered environmental health because it's a facility where people spend a lot of time. Other places that might be included in that category would be nursing homes, potentially hospitals, depending on what state that you live in. But through a contract with KDHE, we do that inspection work. We look at the health and safety issues in a home or in a center, and we do that for any place in the county. It doesn't matter whether it's in an incorporated city or not. We have some function in the communicable disease area. If there is a facility that has a communicable disease, especially if it's a school or a child care center, then we are involved potentially in that through our child care team. We right now kind of work peripherally through the health officer. If we find something that's not quite right, we get a complaint about a bathroom smeared in feces in a restaurant or with feces in a restaurant, we kind of get the health officer's take on that. Even though we ask people to clean it up, we don't necessarily have a lot of authority, but when the health officer talks, sometimes that makes a difference. Public health education, our staff does a lot of that. We go to a lot of the health fairs, all of those kinds of things. And fortunately, when you look at environmental health, it's covers everybody. It's not about healthcare itself. It covers a lot of things that affect the whole population and not just individuals. As far as rabies investigations go, we are the folks that kind of verify that the dog, after it's been through quarantine, is still alive. And if it's not, we let the nursing staff know that so they can recommend the post-exposure prophylaxis shots. So we've done quite a bit with quarantine in the rabies program. And then solid waste. Our solid waste code actually covers the whole county, including incorporated cities. We've had some nuisances in Topeka where we've been able to help, a used oil stored in the alleyway or some other kind of thing that they don't have any authority to do. And depending on what it is, we've been able to help them out. But that's what we do. One of the things that's conspicuously missing would be food safety. We do not do food inspections. We have not since 2000. At one point, the state at KDHE did it, and then it was moved over to the Department of Agriculture, where it is now. But we will, in an outbreak at a restaurant, work with KDA, or at least use their inspections to kind of give us an idea of what's going on. We still have a couple people in environmental health that have expertise in that area, so we will use them as best we can. In case you ever have a complaint about a restaurant, it's 296-5600. Call them. And then if they need us, they'll call us. But that's it. But basically, this is an opportunity for the health department to highlight environmental health, give you a book that is written for boards of health. So it gives you, what your responsibilities might be and things that you can look at or think about to decide, how should this go? Which way do I want to deal with this stuff? So if you ever have any questions, please feel free.
I have a question. So in those areas where air quality and food inspection then that are done by the state, then the Board of Health is not held responsible for those types of things if it's at a state level?
That is something that there's a couple paragraphs about board responsibility, and I don't know that you would be completely unliable. I don't know the answer to that. I think it would depend on how the law is written and some other things.
Yeah.
But it's an interesting question, and I do think that that's something that if it'll make you more comfortable, we can either figure out a way to get you that answer, or I believe it's in the book.
Yeah, well, find it, if you could find
I
it
will
in the
look- I
book,
will- yes, I will-
point me to where it is in the book.
That'll be what I do
Because I
this
tried to
weekend.
look real quickly, but I didn't see it, so, but that would be my question, is
Yeah.
for those things that we aren't directly responsible for, then are we still held, responsible for those things as the Board of Health? So,
I
yeah,
will look
that's the
that
question
up.
I would have. Okay.
You might reference accreditation and how.
That's what I was going to next.
Okay.
We do think alike occasionally. With accreditation, there's the function of assurance, and part of what we will be doing in the future, whether we go through the full process or not, we've adapted the models and standards as our basic standard for how we operate. And so things like food inspections, do I need to have some of my staff do an audit of the results based on the standards that the KDA sets for itself to make sure that they're doing what they're supposed to be doing? Same thing even with programs that we really do. What's our enforcement response? Are we in the past, how many hearings did we have in a year, and how much do we have now? So we will be doing more research about those things, and when we do them, we'll let the public and the Board of Health and all of the other folks involved know that. Because data is important. It's just, it's hard to collect, and if we haven't started doing it yet, depending on what it was, it'll take a little bit of time. But accreditation is definitely an impetus to have us start doing that. Because assurance is a big thing. A lot of people still don't define assurance at the public health level, just because that's a big thing. Depends on how you define it. It depends on how much work you're going to have to do. So our definition is, if I've got a KDA inspecting the restaurants, we want to know that they're doing it well. And if we see patterns that show us that they're not, how do we research that to verify? Verification is also going to be a big process in the future.
Okay.
Questions?
And when does the health officer have to intervene?
Yes, we do. Our health officer is very good. You've listened to him before. He's in practice. He's just as good as he is when he's talking up here. But we do have.
He just walked in the room.
Ed saw him coming in. I believe that.
So yes, and we almost unless we just forget, we'll consult him to verify that the direction that we're heading is where he wants to go, because he does have the authority, and that makes a difference. And you give him the authority, so your knowledge of what's going on too is very important.
Okay. Thank you very much.
You're
Ed.
welcome.
This was very informative.
I would just like to follow up and make a note that environmental health is really one of the ways we started public health in this nation. And so it's kind of a lost art. There's a lot of people retiring from environmental health. And so we need to somehow get our focus up in the world so that people know environmental health is important. We need people coming into that field. And so we're lucky to have the staff we do, and the health officer that helps us make those decisions. Of course, we have the county code that we follow as well. So a lot of pieces in place, but again, there's a lot of folks that are eligible for retirement, if not now, in the very near future. Not just here in Shawnee County, but across the state. So we'll be losing a lot of very valuable information.
Well, our question, are we working with Washburn Tech and maybe other schools that can replenish what we're losing?
I think, and you can clarify if I'm incorrect, Ed, but I think the Masters of Public Health programs are the ones that really give those folks the credentials. And so they have one at K-State, they have one at KU. So we have some local areas where people focus on that. But we haven't had any vacancies, so we haven't really had to throw a net out there to see what we could get.
Okay,
So a lot of unknowns there.
thank you.
Okay, if not any other questions, we're going to go ahead and move over to the communicable disease trends. I have Carrie Delph, who is here with our CD program. She's the team leader, and she's going to talk about mumps and streptococcus pneumonia. So,
Good morning. All right, so mumps has been in the news lately. This is a viral disease often associated with fever, swelling, and tenderness of one or more of the salivary glands. Other symptoms can include headaches, muscle aches, tiredness, loss of appetite. Some people do not have any symptoms of mumps. We can see complications from mumps, including inflammation of the testicles, ovaries, brain. It can also cause meningitis and deafness. There is no cure for mumps, only supportive treatment like rest, fluids, fever reduction. Mumps is spread person to person via droplets of saliva or mucus, usually when someone coughs, sneezes, or talks. Mumps can be spread indirectly through contact with contaminated surfaces. People typically show mumps symptoms 16 to 18 days after exposure, but it could range anywhere from 12 to 25. And the most effective measure to prevent mumps is to maintain high levels of immunization. That mumps vaccine, the MMR, protects against measles, mumps, and rubella. It's typically given to kids when they turn a year old and then again before they go to kindergarten. 2 doses of vaccine is also recommended for adults at high risk, including international travelers, college students, healthcare workers. The vaccine is very safe and effective. It's about 88% effective when a person gets both doses. 1 dose is about 78% effective. Individuals with mumps and those that are unvaccinated could be excluded from school or daycare if disease is present in the community. Students entering schools in Kansas are required to have at least 2 doses of mumps vaccine, be able to show evidence of previous disease, or have blood tests showing immunity. There are cases where medical exemptions are allowed or religious exemptions. When there is a case of mumps in the community, those are reported to KDHE. KDHE contacts us at the health department, and then we begin our investigation. So the nurse with the health department would contact the reporting medical provider, collect information about symptoms, when it started, any complications or vaccination history. The nurse also interviews the patient to determine possible source, maybe risk factors, or where it was transmitted. We're going to focus on that incubation period, that 12 to 25 days before the symptoms started. And then we're also going to look at the 3 days before their symptoms started and the 5 days after to see if maybe they were possibly spreading it to others. Previously, there were about 186,000 cases each year before the vaccination program began in 1967. Since the vaccines began, we've seen a 99% decrease in cases. Year to year, the number of cases can range from hundreds to thousands. Some years it's higher because of outbreaks. And that's kind of what we've been looking at recently. So this is information from the recent outbreak, 2016. These cases have mostly affected young adults. And then just in January, about an additional 500 cases were reported. In Kansas, this information's recently been updated by the state. As of March 4th, the state's reported 56 cases of mumps in 12 counties across Kansas, but none in Shawnee County at this time. And again, this has been updated. So any questions on mumps?
Actually, why young adults? So, I mean, you said that most of it was in young adults, but if they were vaccinated, then
There's questions maybe about the effectiveness with the vaccine for these young adults, if maybe they're reaching a time where it's not as effective. Again, with the vaccine, you're less likely to get mumps, obviously, but when you've got these groups, people that are unvaccinated are going to be getting mumps at a higher rate than those that are vaccinated.
Okay. Just
I
interesting.
think several cases have also been associated with college.
If you can go back one slide. 3 of the
Yeah.
4.
Yeah.
In colleges.
The COVID cases were high school, correct?
I believe so.
So.
Huh.
So
Interesting.
obviously there is a transmission, easier transmission in a
Mhm.
college setting, especially during this setting. And the issue is really seems to be of weaning, of immunity is waning, that's no longer active.
Okay.
And, it's not so much that the vaccine is not effective, vaccine is effective, but now that we are decades into the mass vaccination program, we're starting to find out that protection is not as long
Okay.
lifetime.
Interesting. Yeah, that is interesting.
In some of these areas of outbreak, they're recommending a 3rd dose of vaccine,
Really?
and that seems to be
So in their teens or you don't have to get it before you go to college, right?
right. Typically, you get this when you turn a year old, and then again before kindergarten, so maybe
So-
4
and
to
that's
6 years
it.
old, and then you're done.
You're done.
But in cases with these outbreaks, it might be that they go to a college campus and administer
A
3rd dose to those that are high
Really?
risk. But that's not necessarily the recommendation for
Interesting.
everybody.
Okay. It's interesting.
Another disease we look at is invasive pneumococcal disease. This is caused by Streptococcus pneumoniae. The most common type of infection that this would cause would be like bacterial ear infections, pneumonia, sinus infections. It can also cause bloodstream infections or meningitis, which would be considered the invasive disease. Complications, in 2014, there were 28,000 cases and 2,900 deaths from invasive pneumococcal disease. And that would include the bacteremia and meningitis. This bacteria spread person to person via respiratory droplets. It's common for people to carry this bacteria without showing any symptoms of infection. They won't be ill. The organism can be communicated to other people as long as it's present in the respiratory secretions. People are considered non-infectious 24 to 48 hours after starting the appropriate antibiotic. The incubation period on this is unknown, but it's expected to be short, maybe 1 to 4 days. There are 2 vaccines that are used to prevent pneumococcal disease. One is the pneumococcal conjugate vaccine. It's given to children usually at 2, 4, 6 months old, and then again about a year old. This vaccine's also recently been recommended for adults 65 and older, and then to other adults with certain conditions that might leave them susceptible. There's also the pneumococcal polysaccharide vaccine. This is routinely given to adults 65 and older, as well as some people with other health conditions that put them at high risk. As far as requirements for the vaccine, all children attending child care facilities licensed by the state are required to have that pneumococcal conjugate vaccine. There are, again, exemptions for medical cases or where religious exemptions. Invasive pneumococcal disease is reportable to the state. If the invasive disease is meningitis, it would require quicker reporting. As far as the local health department, the nurse would do the investigation for invasive disease. They contact the medical provider, try to collect additional information, patient demographic information, the site where the organism was isolated, what antibiotics it's susceptible to, if the patient has any underlying health conditions, or their vaccination status. Any questions on that?
Questions?
Thank you.
Thank you.
The reason those 2 diseases were presented today is because we have seen them and heard about them recently in the community, and so, or not in the case of mumps, but certainly the pneumonia. So we wanted to at least bring some awareness to that, and hopefully that gives folks a little more information. Now, we're going to go ahead and move over to tobacco use prevention in Shawnee County, and I think Greg has a little startup that you want to do. He's got a little setup he needs to do real quick. Or do you
Not to
want-
be outdone by Ed's wonderful booklet that you guys have for, nice light reading for tonight. I brought some signs. So just to kind of, and I'll talk about kind of each of these here kind of individually as we kind of go through here. The big one next to you. Perfect. All right. That's not going to stay, is it?
Here,
All
I
right.
put it here.
There we go. Perfect, right? Got to be adaptable. Okay. So Craig Barnes, Health Department. Good to see you all again this morning. What I'm going to be kind of talking today about is the tobacco use prevention, why it's still important, and then give you guys some examples of kind of what we've been doing here in the community already and kind of where we're planning to go moving forward. So that's kind of what the signage is here is kind of representative of. This, in partnership with the Chronic Disease Risk Reduction Grant that we get through the Health Department, enables us the ability to get some signage and work with our partners to make the different policies and system changes that I'll kind of allude to a little bit easier and make it easier to get that information out to the public as well. So starting off, really why tobacco use prevention? Well, I think really this right here kind of sets it up perfectly. Tobacco still continues to be the largest cause of preventable death and disease in the United States. In Kansas specifically, smoking kills annually 3,800 adults each year. So we still know that we still have a large issue with tobacco-related illnesses here in the United States. And so a lot of what we're doing here, over the past 4 years that I've been with the Health Department is really focusing on policy, systems, and environmental changes to really help create a sustainable culture and a change more towards health and wellness in the community. So with that, so tobacco use, kind of as I said here, smoke causes more deaths each year. But what I think is interesting to point out is it causes more deaths than combined with HIV, legal drug use, alcohol use, motor vehicles, firearms, and even like fires. But a lot of times you wouldn't recognize that because, well, what is it that the news outlets are usually portraying and putting out? The things that are murders or house fires and things of that sort. It's I think maybe a little bit difficult sometimes to capture John Q, who might be battling a lifelong addiction with smoking, who might be dying from congestive heart failure or something like that. So those aren't the types of things that really get captured in the news. So you don't really see a lot of it. It's a lot of it you see if you work maybe in the health field. That's something that you understand. But the general public at large, I think that is something that is missed. I know when I was doing presentations in the school districts yesterday for National Kick Butts Day, this is something that the kids, they were very shell-shocked by. And they said the same questions like, well, such and such was in the news yesterday or this and that. Well, a lot of times, types of things like congestive heart failure, cardiovascular disease, and things of that sort aren't really captured by the media outlets. And so it's kind of missed a little bit that it is still the leading cause of death here in the United States. So just kind of wanted to put up here so you can kind of get an example. But tobacco use and smoking is directly associated with a handful, a lot of different diseases. This is not an all-inclusive list, of course, but just some of the highlights and some of the different diseases that a continued use of tobacco can cause. A lot of different ones on there, some that you're probably familiar with and some that maybe you're like, what does that mean? So. All right. So not only but primary or first-hand smoke in tobacco use, but secondhand smoke is also very important and can also cause and lead to different illnesses, especially among young adults. As you can see here, secondhand smoke can cause about 53,000 deaths per year, and that's adverse effects then on the cardiovascular system, leading to congestive heart disease, as well as lung cancer. And I think the biggest thing on this slide, really the second bullet here, but there's no risk-free level of exposure. If you've been following the things that have been happening in Oklahoma with them trying to pass a law to not allow smoking in cars with kids in there, so there are research out there that shows that secondhand smoke is harmful, and there are other alternatives and policies that are going into place. And a lot of what we're doing here with the tobacco use prevention, as you can see, I really like the sign that's on the far side, or not the far side, but the second to last, the young lungs at play, focusing on young adults, kids, and making sure that their areas that they play and get around and get active living are places where they can go and be healthy and not have to worry about the adverse effects of secondhand smoke. Same thing with, and I'll allude to it a little bit later, but the smoke-free multi-unit housing. You guys are probably familiar with the things that are happening with the Topeka Housing Authority, and in June 1st they will be a smoke-free. All their sites, and that'll work out for almost 2,000 residents that'll be not have to deal with adverse effects of secondhand smoke going through ventilation systems and the sort. So, all right. So this is something that you guys have probably seen within this meeting a handful of times now, so I won't touch base on it just briefly here. But this is Dr. Frieden's Health Impact Pyramid. This is something that we as public health professionals use to help us identify interventions at different levels. As you can see here with the arrows, things that are on the bottom, those have a larger impact over a broader scope of the population. Things that we can do, especially within this scope, that are, as I alluded to, policy, systems, environmental changes to make more of a sustainable change. And then as you go upward here, more of an individual effort and more of a one-on-one. So like at the top with counseling and education, so things that are one-on-one. So some of those examples, so policies to have fluoridated water, to have, fluorine in water for oral health. Immunizations, something that, someone will have to come in, you'll have to talk to them about that, but then offer long-lasting protection. Clinical interventions, like treatment of hypertension. You have a little bit of, the patient obviously has to follow through, but also the healthcare provider as well. And then one-on-one counseling, so like dietary counseling, or what I thought was a great slide from a Kansas Health Foundation presentation. This is that pyramid, but with tobacco control interventions built into it. So a lot of what we do and have been doing here recently in the last 4 years at the health department in relationship to tobacco use prevention has followed in this realm right here, where we can, really focus in on a large swath of the population and demographic. But those are things like smoke-free policies, as I alluded to with the multi-unit housing policy, and I'll kind of talk about some other ones that we've done, but focusing on things that will impact a large percentage of the population. That's not to say that, we're not still doing some of these types of things. We offer freedom from smoking classes that are group-based tobacco intervention classes that are for, at the end of the last year, we really did a big push on focusing on pregnant and postpartum women and did a diaper incentive for them to come in and gave them 240 free diapers for going through the classes. But also other interventions like the Kansas Quit Line, which is, we're really privileged here in the state of Kansas to have a 100% free service like that, so someone can call in, they can go online, and now they even have an app that's focused towards young adults, but they can actually talk to a physical person, and they do over 63 languages. So if you spoke French, for example, you could call in at 2 a.m. when you had a craving and actually talk to an individual person. One of the things that we really tried to work on when we did these signage is to make those cessation resources available on that signage so that individuals who might be there and notice that this was a tobacco-free grounds or notice that the apartments, some of those resources are already available. And I'll kind of go a little bit more into those cessation resources a little bit later. So the health and economic impact. So already kind of mentioned this piece to you here at the very top, but about 3,800 Kansans die each year from their own smoking. Kids, about 54,000 Kansas kids now will ultimately die prematurely from smoking if things stay the way they are right now. And then I think this one here is very evident and it speaks a lot, but $927 million there in annual health care costs in Kansas directly associated with smoking. And that can be things like absenteeism, people who are taking time off work, having to deal with diseases and things like that, congestive heart failure, and having to take off work like that. But then not only that, but about almost $200 million there is covered by the state Medicaid program. So, okay. So moving on here, this is just a quick graph that I put together to kind of show the Shawnee County numbers here on the left and the Kansas numbers there in the middle, and then the national averages as well for both overall, then for men and women. If you notice there in Shawnee County, the rate at 21%, men there in the red at 23%, so almost 1 in 4 men in Shawnee County smoke, and then with women at 21.2%, so just over the 1 in 5 women smoke here in Shawnee County. As you notice there, all of those numbers are higher than Kansas, and they're all higher than the national average as well. And then I put this bar in here. This is the goal for Healthy People 2020. That is the goal at 12% for that average to try to get to there. So as you can tell, we've got a little bit of work to do, but this was a great slide that I pulled from a Kansas Health Foundation presentation a couple months ago to show that, but in Kansas here, we have seen a decline. So in 2002, we had the rate up at 22.1, 2014, 17.7 here. So we have seen a decline. One of the things that I'd really like to point out that's happened in this time, as I kind of alluded to, large policies and sustainable change, the Kansas Clean Indoor Air Act that has happened in that time. So making it a little bit more difficult for people to smoke in some places, especially in restaurants, bars, and things of that sort, where I can remember even as a kid going into, let's say, for example, Applebee's, and not conducive to people who are non-smokers because the bar's right in the middle and usually sunken down. So what does smoke do? It rises and it has to go out. And so if you're a non-smoker and you might be sitting by the door, smoke has to try to escape. So really that's coming by. And I alluded to at the beginning here, there's no risk-free exposure to secondhand smoke. But we have seen a decline, and so that's the positive. And the more that we're doing with our young adults and empowering them to help make differences, and then raising awareness, I think is really helping. We're going to start seeing some of those numbers decline even more over the next few years. So this slide, again, I think is very representative of the changing culture. As more and more, I think nowadays, people really understand the adverse health effects of smoking and tobacco use. But more and more, you're seeing more smoke-free or communities that are going smoke-free. And this slide is actually even outdated from when I created it. And so we had in 2016 almost 4,500 different communities that were smoke-free across the United States. Now that's actually all the way up to 4,718 in the United States, and 38 of those are in the state of Kansas. So we have 38 smoke-free communities here in Kansas. So, all right. So lastly here, what I kind of wanted to talk about is kind of giving you kind of the background information and why this is important, but kind of then start talking about a little bit about the examples of what we've been doing here as the health department with some of our community partners. So the first one here I want to talk about is Washburn University. Last year we worked with Washburn University to kind of help them develop a smoke-free campus policy. That was our ultimate goal, was to be 100% smoke-free. We ended up making a compromise. The faculty was a little bit more upset about not being able to smoke than we had anticipated. So we did make it a compromise to originally designate 10 areas on campus. One of those areas ended up being too close to the Topeka Metro's bus hub, which is, they have a policy that their work sites and their bus shelters are smoke-free. And so we ended up taking that one out, and then designating 9 areas across campus that are that were designated smoking areas. As you can notice, except for a couple of them, this one, for example, and this one here, all the other ones are well off the beaten path, really associated with back doors that only some staff will use. When I walked around the entire area to kind of get a feeling of where they all were when we were implementing, I thought it was great where they chose to actually implement them because they were off the beaten path. You had to really go. And so there were different environmental features that would hopefully block some of that smoke, as well as limit them knowing that that might be where there was a smoking section at, and limit the number of people who were smoking. So as of September 1st of last year, that policy was implemented. One of the things that we partnered with them was to make cessation resources available in their student health services, as well as for their employees, so that if they had a new employee that came on board at Washburn, in their orientation packets or materials related to the Kansas Quit Line, as well as different types of these little cards that had the different types of nicotine replacement therapies that they were probably eligible to get through Washburn's insurance. So helping to not only limit the space for people to smoke, but then also to help them if they wanted to make a quit attempt to follow through. So the next slide here is kind of a couple of pictures. So as you see, if you've been on campus before, you've probably seen these here in the last handful of months. But a lot of the areas that were predominantly where their students and faculty might have been smoking and everything, they put up all of these signs, especially around the union, to make sure that people understood that those were no longer areas where they could smoke. And then in those areas where they did designate the smoking areas, they put up these signs so that the students did know that that was somewhere where they were allowed to smoke. Just after I talked to the president of the student government, he's saying that feedback that he's gotten, students are very happy with the policy being in place. They're seeing less people smoking. And the biggest thing, and kind of that happened with this as well, is a lot less litter, honestly, that people are having to pick up cigarette butts that are just being flicked off to the side because they're not just being able to light up and then smoke as they walk through campus. So. The next example here is, to touch base on, is the Shawnee County school districts. Each of the unified school districts in Shawnee County have a 100% tobacco-free policy. As of this last December, we just finally updated the last piece to USD 501s here just recently. But I also like to point out the fact that these all include e-cigarettes as well. So this is chewing tobacco, cigarettes, and e-cigarettes. And we were able to partner with our school districts to get these signs here that really point out the tobacco-free grounds. What I really like about it is a lot of you are probably familiar with the non-smoking signs that have just the cigarette in there. Well, these actually have those vape pens or the e-cigarettes, the electronic nicotine delivery devices that are in there as well. So they're actually pointing out right there on that visual image there that e-cigarettes are also not included. One of the things that we also included on those signs was the information for resist, which is something that here in Kansas we're starting to try to get back going again with young adults, is empowering them to take this information to their classmates and their peers and really try to create a smoke and tobacco-free generation. This upcoming generation of kids, if stuff continues to go, they could be the first generation that might not outlive their parents. So we're trying to do what we can to make that change. So, all right. This slide here is in relationships to work sites. We have done some work with different work sites and employers here in Shawnee County in relationship to the smoke-free policies. The red one here, as you see, that's here for Shawnee County. So we do have a smoke-free policy in place and a resolution, but there is an exemption to that policy. Surprisingly enough, our parks and recreation facilities, as well as the Expo Center, are the exemption to the smoke-free policy here in Shawnee County. And so that is something that, in the future we would really actively like to work on, especially as we try to create that generation for our young adults to have a healthy lifestyle. And if we are really promoting them to be outside and to be active, and we would like to make those areas where they can be active safe and healthy for them to continue to do that. So these are the top 15 employers here in Shawnee County. And as you can see, about just about half of them have complete 100% tobacco-free policies. And what I thought was really interesting to point out is the ones that do, most of them have, that includes e-cigarettes if they've updated those policies in the last couple of years. But some of them even have nicotine replacement therapy cessation reimbursement programs built into there so that they can, if someone is interested in quit, they will actually reimburse them for their nicotine replacement therapy to help them quit. And then lastly here, as I kind of alluded to originally, is the Topeka Housing Authority. We've been really privileged as the health department to have a great partner in the Housing Authority over the last couple of years for a lot of different initiatives. I've been up here in front and introduced them before as we started that East Topeka Farmers Market a couple of years ago. But this year really to focus on the multi-unit housing. They're really doing a great job of creating an environment for their residents and consumers to live healthier lifestyles. And so effective June 1st, they will be implementing the first smoke-free public housing or multi-unit housing policy here in Shawnee County, with the hope that we can utilize them as a best practice moving forward and kind of go and look at other multi-units if those landlords and people are interested in doing so. But the nice thing to point out is this policy will impact over 2,000 residents, and we just completed the public comment period last week. Surprisingly enough, from the original backlash that we kind of received in phone calls, we got more positive public comment back from residents regarding this change than negative. And I think that was, I don't want to say a shock, but a pleasant surprise, that there were more individuals who were for this policy change than that were against it, at least in the sense of that were willing enough to make a comment and submit that comment. So that was something that we were really looking highly about. And that has to do with in this sign down here. We got these signs for the smoke-free apartment signs that as we're rolling these out, we will put outside of all of their different facilities to make it known. And then also some hard signs, if you see in the smoke-free building ones on the far right there, that they will be able to put up then on the actual buildings themselves that won't be able to, that'll actually be like, I guess, drilled into concrete per se. That won't be able to be taken down or anything like that. Some of these ones here, they're not the hard metal, but more so there to kind of raise awareness, as many as we could get up of those in the time being. So. And then lastly here, to the tobacco cessation, I've kind of touched on it here briefly throughout. But the biggest thing to point out, with all of these different policies, system change, environmental changes, what we really tried to make sure that we did was focus on additionally the cessation piece, so that we're not just putting in a policy and saying you can't smoke here, but helping them to then make that quit attempt and make it successful. The average person takes it 7 times for them to make 7 quit attempts for them to be successful. And if we can help make that easier for them in the transition by giving them the resources that they need to make those informed decisions themselves, but then also to help them along the way, that is our goal. And so that's why with a lot of this signage, we decided to put on the quit line information. So that was directly there. And then as we go out in the community and do these presentations, if we during lunch and learns or doing things with the residents, like with the Topeka Housing Authority, we'll do lunch and learns with them, going into the school districts to make sure that we share that information as it relates to the quit line, as it relates to, especially the same thing with those cards. We're going to have these flyers available in all of the Housing Authority places, but this is exactly what Medicaid will cover as it relates to nicotine replacement therapy. And so this will be something that will be regularly available for them, so they can actually take this and have that conversation with their primary care physician, if they have one, and say, hey, my insurance that I have, if I have CanCare, if I have Medicaid, shows that I can get this, is how can I get it? And then on the back, related to pregnant women as well, since we know that we have here in Shawnee County a large percentage of pregnant women who smoke as well. So, so this was just a blown up of what that blue card is that I just held up, the different nicotine replacement therapies that are eligible for those within Medicaid, and then Blue Cross Blue Shield, the different nicotine replacement therapies that they have available through some of their insurance plans as well. And then lastly here, just this is for the Kansas Quit Line. Again, that's that free service that I alluded to, and the information that we put on this signage. A great service, really privileged here in Kansas to have that available, and especially since it's free. And they could actually talk to one-on-one with somebody. And then the freedom from smoking classes that are more, not so much one-on-one, but group-based intervention classes that we host, and we have trained facilitators for at the health department. And that we just kind of had recently wrapped up, that we were focused on pregnant women and giving those diaper incentives. So with that, I am done. And so I'd be more than happy to take any questions from you three, or any questions for the rest of the presenters today.
Commissioner?
No, good information, and I had not heard about the Topeka Housing Authority initiative, so that's
Yeah.
encouraging, yeah.
So really, we're really excited about that, and the Housing Authority, as I mentioned, has been a really great partner with allowing us to impact a large population of really at-risk folks.
Yeah.
And so it's been fantastic the last 3 to 4 years working with them and moving this on. The HUD, the overarching federal, they're the ones who really pushed down this. They had an 18-month period where they could implement this, and they were like, no, let's do it now. There's no reason to wait. It's just going to build anxiety, so let's put it in. We're going to have to anyway, so let's do it,
Yeah.
and then we can troubleshoot as we go. And so that's one of the big goals, is making those cessation resources readily available
Right.
to those folks who might need them. So,
Good.
yeah.
I have a couple of questions. How much time are we spending in middle schools and high schools? And I ask that question because I recall reading research that said if someone's not smoking by the time they're 18 or 19, chances are they're never going to smoke in their lives. How much resources and time are we spending making presentations?
So realistically, when we
There.
go into the middle schools, we focus around 2 observances during the school year. The Great American Smokeout, which is in November. It's right after Thanksgiving, or right before Thanksgiving. It's the 3rd Thursday of November. And so we partner with 2 of our school districts to do presentations during those days around the Great American Smokeout, and then with Kick Butts Day here in March. Those are really the 2 days that we focus on going into the schools, just those 2 days to do presentations with them. With 501 being such a large school district, we make that presentation available to them because we can't get to all of those schools. And so the teachers, the science teachers, will actually teach that on those days as well when they go through their substance abuse curriculums, which fit perfectly around those time frames for the school districts, and that's why we do them only around those 2 times.
Okay.
So.
It just seemed to me that there'd be a tremendous payoff for being really proactive in
Yeah.
middle schools and high schools.
Yeah, and so what?
was in the schools yesterday.
Yeah, so
Okay,
yesterday.
good.
And then what we also do, is I feel privileged enough to be able to sit on a lot of our school districts' wellness councils. And so that allows us to really work with the staff and the administrators to work on some of these policy addendums and stuff like that to make smoke, readily not available, to those students. One of the issues that we're still running into here with high schoolers particularly is with the smoking age being 18 as it is, a lot of high school seniors are 18 before they graduate. And so they're able to buy cigarettes, and then they're coming in back into their schools with cigarettes. And then if they have younger siblings or, younger, that's typically nowadays how we're seeing that more and more young adults are picking up smoking, is because of peer influences from those who are able to readily buy cigarettes or tobacco legally.
So the age is 18? I thought it was 21 for some reason.
There are some entities, so like Wyandotte County, the Kansas City metro area has done a Tobacco 21 initiative, so they've raised the age to buy in tobacco to 21. But here in Shawnee County, and for most of Kansas, I believe, it is 18 to be able to
So why
purchase
can't
tobacco.
we have 21?
That is the best. Yeah, we can make that happen. Yeah.
It's actually an emerging practice.
It is.
Becoming, more widespread. It's
I'd like to see a
communities.
proposal
Okay.
to do that.
Yeah.
Because the drinking age
That-
is 21.
Yeah, drinking age is
We can
21,
most
and-
certainly work on something for
Okay.
sure.
Now, this, I have a quick personal story. This is something that's near and dear to my heart. My father had a heart attack when he was 45 years old. And the doctor came in and said, Mr. Archer, you need to lose weight, you need to stop drinking, and you need to stop smoking. And my dad said, Doc, I can do 2 out of 3. And he smoked until the day he died. It is a horrible, horrible problem. So anyway, thank you for indulging me. And yeah, I wouldn't mind seeing a proposal and get some
Definitely.
feedback on a 21. So
For
thank
sure.
you again.
Yeah, no problem.
If I may make two very quick comments.
Yes, sir.
If you allow me. One is that you may remember when we discussed the county rankings
Uh,
last year.
Dr. Pizzino,
I'll give you the podium.
Because it's being taped and there's no microphones out there.
Thank you. It will take just a second. When we discussed the county health rankings last year, we noticed that Shawnee County has slipped in its ranking position. You may recall that one of the main reasons for that was that our smoking prevalence was actually higher than the rest of the state. It was going the wrong direction also. It was going up instead of going down. So there is actually an impact of that on our overall health at the community level. The other quick comment is that the research shows that most smokers want to quit. They really do. They just can't. And so what we are doing by creating an environment where smoking becomes harder, we are actually creating an environment that helps them make the right decision, the healthy decision that they already want to make. And so, there is probably a certain number of hardcore smokers that are not interested in quitting and they will oppose any kind of interventions like this. But many will tell you, thank you, because the moment you make it more difficult, at the very least I'm going to cut down. But there will come a day probably that I'm going to be able to quit, which is what I really want to do.
okay. Thank you.
Well, I can tell you that I can remember having these conversations with Craig probably 4 years ago about trying to get tobacco-free housing available, and we've also talked about the smoking age being 21 for a while now. We had kind of a projected plan for bringing those items forward, so I'm excited to hear that you'd like to see something, and we will definitely get that for you. Great work, and I know there's lots of partners that are at the table helping us get these efforts going, so just need to acknowledge that as well. I do want to talk about, I said earlier that we were not going to be doing the county health rankings at this point. They have not been released yet. March 29th, they get released. And we will then, on April 3rd, we kick off National Public Health Week. And at that time, we plan on having a meeting on that Monday at the Health Department that's open for the community to come. We will be inviting our normal partners that we partner with, elected officials from both local, city, state. We will ask them to come or invite them to come. We will have the health officer will be there, really facilitating that discussion. And we're thinking of it as a community conversation so that people can get more engaged, understand what our issues are, and maybe help form some solutions. So that will be coming up on April 3rd, and those invitations will be coming out very soon. I just want to thank our speakers that don't normally do this in this setting, so thank you all for coming. Good job, and I'm happy to answer any questions you might have.
Yeah, speakers all did a great job. Thank you. Thank you very much. Commissioner?
Very
No?
helpful.
Commissioner Buell?
Thank you. Thank you for all your time
Thank
and
you.
efforts.
Okay. Thank you, Allison, and I guess we'll officially adjourn.